way we do it, basically is similar. Was developed by independently by some guy in Ireland and another person in France. And I just thought there's two basic ways of doing it. I just thought I'd go through it just briefly. In enucleation, you're taking out the globe, and maybe, and generally you don't want to leave too much behind. You are leaving the periosteum, and you want to remove secreting tissue. The simplest way to remove all the secreting tissue, the conjunctiva, the lacrimal gland, everything, is suture the eyelid shut and do the transpalpebral technique. And so you suture, suture the lid shut, dissect posteriorly, transect the muscles, and so forth. I mean, here's one way to do it. Here's you can suture or use towel clamps. A lot of swelling in this eye in there before we even start. And just dissect. It's a bloody procedure for an ophthalmologist, not for some of the other horse surgeries, I guess. Transecting the optic nerve. I like to clamp it and then cut it. A few people still try to ligate the optic nerve and then cut it, but I don't have any luck with that. You're working blindly in this, in a sense. You can't see what you're doing. The subconjunctival method, some people like it a little better. Maybe the vision initially is your ability to visualize what you're doing is a little bit easier at the beginning, but the risk of leaving secreting tissue behind and causing a problem is a little bit greater with this. Both techniques are the same once you get past the fornix, which is where the conjunctiva reflects on itself. The transpalpebral and the subconjunctival enucleation methods, they're the same once you get the dissection and you start to transect the optic nerve and cut the extraocular muscles. I mean, here's we've made a dissection now. Here's the just dissecting the tissue away. Then suturing the conjunctiva, suturing the deeper fascial tissue. You've removed this conjunctiva. And then suturing the lids, suturing the skin. I bandage them for a day or two, just put pressure on the eye so it doesn't swell too much. This is generally considered to be an extremely painful procedure, and yet most of the time I do enucleations, you can tell the horses feel better afterwards, so they must have been in a lot of pain before. Warn the owners what they're going to look like. They don't like these pits. I don't like them either, but the horses usually don't care, and the owners usually get rid of it. Their owners usually get used to it. I hope they don't get rid of it. You can put these orbital implants in. It's up to you. They're available. They tend to minimize the pitting, and but maybe in some cases a year or two later, you end up having to take the implant out. And I think the reason for that is if you're going to put an orbital implant in, you should catheterize the nasolacrimal duct and put some tincture of iodine into it and damage the duct. I think if you don't, you run the risk of migration of bacteria up the nasolacrimal duct into the orbit because you didn't damage it. And once in a while, then that causes some orbital cellulitis post-op. Here's another one. Here's where the later on where the implant's coming out. It's extruding. This was getting some skin ulcerations that are really full thickness 1 year post-op. You can do intrascleral silicone prostheses. These are different ways of doing it, but there are options. There's a cheap way this is the cheap one on the left. This is an eye that was removed. The contents of the eye were removed 10 years before. This is the horse's normal right eye. The eye looked fine.